Grand Rising Mummies, thank you for tuning in to the Gossip Moms community. I am Keisha Enough. This is my middle sister Tasha.
And our baby
sister. No, it's cool. Okay, so this morning we wanted to come to you because I created a platform that will allow you to be informative, to be uplifting and inspiring, so that you can. What's wrong? So that you can. They're silly. Don't mind them. So that you can ask questions, have answers. We ask questions because all things mummy is what we talk about on the Gossip Mom community. Today is Hyperemesis Gravidarum awareness, and we wanted to talk about that disorder because all three of us had it. I had it moderate. Tasha and Ashley had it severe. Don't mind the kids. We got kids. It is what it is. Ashley, how did you find out what the disorder that we had? How did you find out what it was?
Well, through one of my friends who's a registered nurse. We were at a gathering and, we were speaking about our pregnancies, and I was telling them how hard my pregnancy was, and that is when they told me the name for the medical term.
But Tasha was the first one to have a child in the family. And so, Tasha, at 19, what did you experience when you had Alicia?
Well, I experienced a lot. It was awful.
But what was some of the
the side effects was vomiting, not being able to eat, extreme nausea. Also loss of weight from not being able to eat. I went into almost 8 months with not being able to eat, so I lost probably 35 pounds. Was hospitalized for it. And so I didn't know at the time what the medical term was for it until Ashley got pregnant with her last baby, and she was able to let us know what the medical term was.
What's up, Eric?
It's time for food.
We're going to go to the pool in a minute, son. Okay, and so speaking of that, Ashley, you didn't find out until you was pregnant with your second child. How old were you? Because you went through it with your first child, where it almost...
Yeah, I almost died with my first child. It was extreme, and I didn't know what was happening. I didn't get prenatal care with my first child until I was 5 months into my pregnancy, because the first 3 months I couldn't get out of bed, and I didn't have any help.
Any support.
I didn't have a support system. And the hospital kept sending me home saying that it was just morning sickness, but eventually... After 5 months, I was able to get well and go back to work. So I didn't think anything of it to look into see what it was. But when I got pregnant with my second child at 28, I had to get a PICC line put in my arm so that I could get the nutrients I needed because I couldn't eat. The whole 9 months I threw up, I vomited. It was...
And you had a support system.
I did have a support system this time around. But it wasn't until after I had my child that I was able to learn the term, which is hyperemesis
Gravidarum. And okay, so what was some of the emotional strains on you, Tasha, as when you were young and when you were 30 something that you had at Abel?
It makes you feel very depressed. It makes you feel alone. It also makes you have thoughts that you shouldn't have. And you really don't even you don't even really feel the way that the thoughts are making you feel, but it's that bad to where you start to feel that way about the whole pregnancy.
So I was blessed to have had my child last, and because of my sisters having hyperemesis and Ashley finding out with her last baby, I had my baby 3 years after they had their last children, and so I had advocates. My sisters then made sure when they went into the doctor, they're like, look, she has hyperemesis. This is what it is. It's hereditary, Ashley. Did you find out if it was hereditary?
Yeah, it is.
And so Tasha was up there advocating for me. So my doctor, he took me off work. He did what my sister basically told him to do because he wasn't going to tell me that it was hyperemesis. Like, as an African American, we're not getting the type of care that our counterparts are. Nope. And what I'm learning is that you have to take time to help others be educated so that they'll know. So we're doing this just because I didn't see any African American women on there when I was searching Hyperemesis Gravidarum on YouTube. It was not no African American women on there. I listened to a lot of Caucasian women and Hispanic women talk about it. So we're trying to be advocates for like women of color and hyperemesis awareness, so that you don't have to know that you're not alone. I literally, it's your vision, your ears ring, you constantly vomiting. It's no such thing as morning sickness, night sickness, the noise. And even though I had my sisters there and my child's father would call every day because he's a truck driver, I didn't want to be bothered. I just wanted to sleep it off. It was so sad. I was so depressed. And as long as it took me to have a child, I didn't even really want to carry the pregnancy through. I believe because my sisters and them kept coming and bothering me. I say bother because I didn't want no one around. I literally just wouldn't have cared if my seed fell in the toilet at that time, because I just wanted it to be over. It does cause you to be depressed, to think about abortion, to think about, I don't know, I didn't feel like harming myself. I just wanted that to go away. So if anybody is suffering with extreme nausea, what was that medicine they gave us for nausea? Zofran. I had a Zofran pump in my stomach. I had to.
Yeah,
you had to poke yourself every day.
I had a Zofran pump too.
Did you have to poke? I poked myself in the stomach every day.
Yeah, and it didn't.
And it did not work.
There's nothing that work. I even had the highest medication for cancer patients, and it
still didn't work.
When your body is,
it just depends on the person.
Yeah, it definitely.
I never felt like I didn't feel like terminating my pregnancy, but I knew after a year I did want to get my tube tied, but the doctor refused to tie my tubes, and then after Abigail,
because you were too young.
Well, I was 20. You had 21 when I actually.
And we also want people to know that just because you have these thoughts don't make you a bad person, because the sickness and the illness is that bad.
It is. You can't. Yeah. So don't feel bad if you're going through that and you have those thoughts. Like for me, after I had my son, I decided to tie my tubes. I was 36 when I had him, and I didn't want to go through that again. I'm sorry, I just didn't want to go through it again. I really wish that I didn't have that, because I feel like it took the joy out of my pregnancy.
Definitely,
it did. To make you look at
until you got better. Until I got better, because I got better after 4 months. I had 3.5 months.
I had her.
And Ashley didn't. And
my second child it was till I had her.
Yeah, with my first child, also due to the illness, the hyperemesis, sometimes it can cause you to have the contractions and everything. So I had to early labor. So I had to get like progesterone shots.
Yep.
Also to develop their lungs early. It was a lot that went on with my pregnancies, and so everyone, like Keisha was saying, that we just want everybody to be educated, especially women of color, where they can actually know the terminology of the medical term of what's going on with their bodies. Due to doctors are not really
compassion, empathy. Really, I would say not doctoring, because I felt I can't say that my doctor didn't care, because when my sister
they probably don't really know much about it either.
Some of them don't, some of them do. And this is the thing. Ashley's doctor told his that was the most extreme in 20-some years he ever dealt with, right? Yours was the most extreme?
Almost 20 years.
And my doctor just was like, my sister was I think my sister was so like forceful on him. Yeah. Like she was like, listen, we've all been through it, and this is what they had to do, and they had to take you off work, put IVs in you, and give her this and that. And my doctor was like, okay, since every single one of you been through it before her, I'm gonna do that. And so my doctor was a very easy doctor, but not all doctors are understanding, and some of them think because we are strong in structure that we don't feel what others feel. But don't let nobody tell you that you don't have something that you know you have, especially if
it's common nowadays too. It's really
so what is it again? If you're vomiting 24/7, if you're putting something to your mouth and you're vomiting it up, and then if you get dehydrated.
It's a certain taste that is in
your mouth. It's like I can't tell you if it's a metal taste or whatever taste, but your taste, it's like
acid reflux times 10.
Yes. And if you have blurry vision, if your urine is so dark, that means you're in ketosis, so you're dehydrated. If you're losing a large amount of weight, if you're nauseous 24/7, and you can't do your normal duties like go to work.
Sunlight, sounds, like Keisha was saying, you'll start to feel that as well. So you definitely want to go in as soon as possible. They will try to tell you at first that it is dehydration. It is not.
And yes, definitely don't let nobody tell you that you don't have something that you now have information to. Look up Hyperemesis Gravidarum and look up all the symptoms that come along with it, and you'll know it's a disorder. But once you have the baby, it goes away.
It goes away.
But the depression, I had postpartum.
They don't tell you that.
I had postpartum, but my postpartum wasn't like I didn't want to be with my baby. My postpartum was like I fought so hard to get him here. I didn't want anyone around him, from his father, my parents, my sisters. Them I would let them come around, but I didn't. But I was really like clinging to him.
You had anxiety symptoms.
Yeah. So
I was depressed during my pregnancy, but after I had her, I was fine.
And what about you?
I was depressed during and after and still.
And so these are three different women, three different situations. It's just the fact that we're sisters and we all had it. So we want to make sure that not only
to raise awareness,
to raise awareness, not only for women of color, but just all women, young women, and age don't matter, because she had it at 19, she had it at 19, I had it at 30 something.
Then I had it at 28.
So age don't matter, and they've had it with every pregnancy, and it gets worse. People don't tell you it don't get better, it gets worse. So we just wanted to bring awareness and say thank you for tuning in to the Gossip Mom community.
Gossip Moms.
Okay, mommies, have a good day.